Hello and welcome to HIMSS. I'm your host, Jonah Comstock. Last month, HIMSS hosted the State of Healthcare, a digital event where 4 HIMSS Trust partners presented all new data about current trends in healthcare, and the data and trends were then discussed by a panel of healthcare stakeholders. At HIMSS 21 next month in Las Vegas, we'll be reconvening our trust partners in a new in-person forum, this one focused on the future of healthcare. Our fourth and final trust partner representative, Dr. Daryl Givings-Isaac from Accenture, wasn't able to join us all today, but we'll be doing a separate recording with him and hopefully tagging that on to the end of the podcast. So stay tuned for some thoughts from Daryl. So first of all, thank you all so much for joining me. I know that it's a busy time. We're all gearing up for conference, but it's really nice to have you all here to kind of talk a little bit about this. I wonder if everyone could just start out talking a little bit about what you presented at the last event, in case people didn't hear. Maybe share, a very quick overview and maybe one data point that you thought was maybe the most interesting.
Okay, so from a patient perspective, let's talk about digital health. Overall, telehealth has presented a very convenient solution, though as we emerge from the pandemic, it looks like there's a general sentiment from patients, from consumers to kind of go back to normal. I do feel like currently this is a thread that we see throughout different industries in our day-to-day life. So anticipate that the convenience will kind of, charge forward and offer a really great solution, especially to those in younger generations. AI/ML is overall a spooky term. We don't know where patients have learned about AI/ML, but when you break down the benefits that it can give to them, whether it be diagnosis or treatment, there's a high regard for what this offering can bring to them in the future. Financially, patients are pretty happy with those, that have health insurance are pretty happy right now. But that's a really interesting statistic. We haven't necessarily seen satisfaction this high before. So where is it going to be post-pandemic? Right now they're getting telehealth visits or COVID tests. They're seeing a lot of value for the investment. So it'll be really interesting to watch over the next few years.
Great. Tom, you touched on at least a few of those things also. I remember you spoke about AI and machine learning also, right?
Yeah, it was interesting. We talked a lot about obviously digital health and then AI and machine learning. I think the big point on AI and machine learning is that it's not really clear what the value proposition is yet for health systems. And we actually talked about the use cases that they saw the most current state benefit. And obviously we'll talk about the future state in person at the conference. But it was really focused principally on operational use cases. There wasn't a real clear value for clinical care delivery, which is kind of an interesting counterpoint to Lauren's. Patients are expecting this kind of cool whiz-bang sci-fi type of thing. And health systems are still very much focused on AI in the context of how do we make our operations run administratively better. The other big factor that I think kind of a key takeaway is the barriers to digital health adoption that virtually everyone that we surveyed articulated really weren't external factors. It wasn't a question of patient demand. Patients want digital, patients want virtual care. It was really concerns around the regulatory and reimbursement environment. And then how do you actually change the business to be able to provide that care, provide a hybrid model of physical in-person care as well as virtual care seamlessly in a way that's financially sustainable and operationally viable. So it was interesting to see that the market demand is clear from the provider of the health system side. It's just how do we get ourselves positioned to meet that demand?
Interesting. And then Shreesh, well, just to recap, because I think I wasn't clear on this in the intro. Lauren was sort of talking about the patient perspective. Tom, you were talking more about the health providers, health system perspective. And Shreesh, you were talking about the payer perspective, right?
Right. We focused on payer segment, and from payers' point of view, as we conducted our research and spoke with many payer executives, there were 4 key takeaways. One, the most importantly, during pandemic and coming out of pandemic, payers have realized the benefits of innovation and the fruits of innovation. So there is a forward-looking, continued optimism in moving forward, invest in technologies, and see how could they create better patient experience, how could they create a better network optimization connection with providers. So it's kind of moving forward. Most importantly, we talked about AI and ML, and there also we spent a lot of time understanding what's really going on. Interestingly, for payers, half of them, close to half of them, had already moved to the point where they had set up a center of excellence within the enterprise. They started looking at very meaningful, tangible use cases where they can create an impact, either from patient experience perspective or from analytics point of view, and develop a return on investment. And other half of them were claiming that they were able to realize a return on investment on some of those use cases. But to Tom's point, the overall, even from peers' point of view, we are looking at more of the use cases which are operational in nature and not more strategic, going beyond and looking at either from clinical decision support perspective. So that would be very interesting to see as we get to the future state of healthcare, that what do we learn there? How does it shape up going into 2025, and what's the run up to that?
Yeah, and that's a great segue. So it's fairly straightforward to do research and poll people and get data about what's going on now. But figuring out what's happening in the future is obviously harder. It's another layer of complexity. So I'd love it if you guys could talk a little bit about what that's going to be like at the event in Vegas, and what you've been what steps you've been taking to sort of prepare for that kind of a presentation.
Yeah, I mean, the recurring theme that we heard in the survey respondents was, we're going to need to do more. It was investment in digital is going to need to be not just higher, but significantly higher. I think we had 70% of our respondents saying that they saw digital health as an area that was going to need significantly more investment. And we threw some numbers out there, and a large chunk, it was 8-digit figure incremental investment. So this is not insignificant for most health systems. It's something they know is going to be incremental to what they're doing now, incremental to their current business, which really poses some tough questions. And I think the assumption in there was there's going to be also a shifting from fee-for-service to value that has been kind of a slow and steady move nationally. They're expecting it to continue, and so that's going to mean new competencies, new capabilities, and I'll talk some of the other pieces that we did in some of the other questions today. I'm sure I'll hit on some of the other thematic elements that we're hearing of where they're seeing they're going to have to invest beyond just the move from fee-for-service to value.
And what about Lauren and Trish, and any insights about the process of sort of trying to gather insights about the future?
Yeah, from peers' perspective, we are very interested in seeing some of that forward-looking optimism which has continued thus far in certain segments, how it's going to have its impact. First and foremost, we have been talking a lot about predictive analytics, prescriptive analytics, bringing in these analytical capabilities into providers so that we can address issues around clinician burnout, fatigue, which has been experienced. How could we make a clinician's life better in terms of bringing that analytical rigor there? More from, again, AI and machine learning perspective. The second, as we are seeing an uptick in the adoption of value-based care arrangements, what are the key drivers which will continue to create better alignment of incentives between payers and providers, how it's going to pan out, where we see that adoption happening? So these are a couple of areas where we are very interested in seeing what indication we get, and we'll be looking forward to learning and sharing in the future state of healthcare.
I have the very unique position where I represent the voice of the patient. So I'm really excited to see everybody on stage collaborating together, because ultimately that's why we're here. I can tell you where patients are, how they feel about digital health, where they want digital health to go and that interaction to go, what they're looking for technology innovation in the future. But at the end of the day, our payers, our clinicians, and our health systems all need to partner together to really caretake for the patient on their journey in healthcare.
Absolutely. So let's talk a little bit about the future And as you, I mean, it's so difficult to prognosticate, but you can by talking to a lot of people about what they're at least intending to do and to focus on, and that's the sort of theme that I heard from you guys. But what are some areas where there's more uncertainty, where it could go a couple of ways? What are we really kind of waiting and seeing?
The question is, I think, what happens specifically sequentially next? What we heard a lot of was a wide array of different initiatives and different topics, and it all depended on some of the stuff I was alluding to before, some of the broader contextual factors, right? What are patients going to be comfortable with? How does the tech industry evolve? What's Google going to do? What's Amazon going to do? We saw very, very clearly that virtual visits, most health systems feel like they're on that path. They've kind of got a glide path to be able to solve virtual visits within their organization for kind of the immediate term. But then the list of topics beyond that, if you look at how to manage and engage and retain patients, there's a wide range of topics. And we saw a pretty, peanut buttered smattering of which ones were the most important from everybody. And it was spread pretty evenly across those areas, which really highlights very different strategic intents, right? You can't pursue all those big initiatives at once. And so I think the uncertainty is less about the macro vision of what a digitally transformed future looks like, but really specifically, practically, how do you get there? How do you prioritize what happens next and recognize the other players? And Shirish can talk about where the payers are moving versus where the providers are going to move, and make sure they're doing something that isn't inherently competitive with each other. Because then at the end of the day, all they're doing is creating confusion for what Lauren's talking about, the patients and the consumers.
I would actually love to go to Shirish, because I think one answer is pretty low hanging fruit to my own question is value-based care. Certainly something we've been talking about for years and years. We haven't seen as much concrete motion on it as I think a lot of people would like or would have expected. So what's your sense of what's going to happen there?
Yeah, based on some of the data we gathered and the insights we have been looking at, that during pandemic, that value-based care adoption has accelerated, and the providers who operated under outcome-based contracts have fared relatively better. So there is an alignment emerging there. What is still being figured out, that from clinicians' perspective, which micropopulation segments we go after, what disease area, and how do we do the better care alignment from coordination of benefits perspective. And the second added dimension to that we have also seen that government regulations coming in favor of that, specifically with the measure of data interoperability. So now we have recently passed July 1, 2021 timeline in terms of providing patient data access. It would be interesting to see that post that timeline, how did industry fare on that? Second, what are the forthcoming regulations? How are we going to enable more provider to payer data enablement and creating true interoperability in terms of peer-to-peer data access, provider-to-peer data access? So these are kind of the uncertainties there, which are going to create a significant impact on many dimensions. And value-based care happens to be just one of them.
Lauren, I know in your presentation at State of Healthcare, you talked about generational factors. As when you talk to patients, there's a big difference between younger patients and older patients, the so-called digital natives. And so I'm wondering if that is ever a source of uncertainty when we think about what patients are planning for and expecting. What is the youngest generation going to be like in healthcare?
I think it's a really interesting time, especially not only in the current models that healthcare has had historically, but these online only providers are coming. So I'm interested to see if in the future the business model of healthcare has to flex and adapt to stay competitive. We've done prior research at HIMSS a couple of months ago and did see that these younger generations are also going to these online only providers. So what does the future hold when it comes to business models, and how can we be agile and nimble to meet the needs of the patients?
And how much of our expectation of what a healthcare provider should be is based on just our experience, which might not hold for a generation that wasn't raised with that experience versus, what we really find that we need from that relationship. People are always talking about it in terms of the relationship.
What do the younger generations feel in the value of the relationship? Many don't necessarily have a PCP that has them on record, but will they want one at a future time when potentially there's other, healthcare comorbidities as they get older? So who knows? These are digital natives and there are different business models coming into play, but I think the future, there's a lot of uncertainty of what this is going to look like, but as long as we're kind of looking at all paths, I think we'll be well prepared to take care of the patients when they get there.
We have a little bit of time left. I want to throw it open a little bit. What are some things we haven't talked about yet that you guys think are interesting pieces of the puzzle or important pieces of the puzzle? Feel free to talk a little bit about what you're going to talk about, or things you've already covered a little bit.
There's a couple of factors I can talk to, and they kind of tie in some of the stuff that Shrish and Lauren talked about. But the competitive dynamic is changing, and we saw that in our future state of in the financial health section, and we'll talk about that. That we're seeing an appreciable increase in non-health system threats for health system, right? Whether that's other care providers, the digital native organizations that Lauren's referencing, the digital only organizations, and it's really kind of creating a different set of areas of focus for health systems. And one of the big battlegrounds that we believe every health system is going to have to come up with a plan around is the battleground for the home. Not an area that health systems necessarily have a real strength today. The tech companies obviously own the connectivity and the devices that live there. A lot of questions of the best way to deliver care, but for all of us, being able to get care in the comfort of our home is a theory and a concept that is pretty attractive. And so I think it's a specific area where the competitive overlay and the site of care considerations of an entirely new site of care, entirely new capabilities, it's going to be a really interesting next few years to watch how it shakes out. And CMS has given health systems a little bit of a leg up right now with the waiver for hospital at home. But once the public health emergency ends, and we're back to our new normal, we don't know what it's going to look like. And so how that's going to play out is going to be really interesting. And the first movers will likely have a really powerful advantage and a growth platform that those that don't move won't.
Yeah, and I would like to build on just what Tom and Lauren had shared. It would be interesting to see and share that as we are talking about these multiple themes emerging together, like for instance, Tom is talking about the site of the care is shifting. It's going more from hospital to ambulatory to remote and home care. Yet at the same time, there is another driving force that we have a lot of digital native, digital only patients coming into healthcare system. So how do we create a structure where some level of personalization can happen within the bounds of constraints we have, both from the organization and from the technology perspective? And then other added dimension is that a lot of big techs are moving into healthcare. Experience haven't been great. So how could we see a better integration in terms of healthcare organizations bringing that clinical expertise, and then technology organizations bringing that technology prowess to move the mission forward for digital health? So these are a couple of very interesting cross themes, which would be very interesting to me personally to understand and explore and see how we all could help move it forward.
Wearable technology. It's a really great technology. People with cardiac issues can do EKGs and they can do their pulse. You can do oxygen saturation. But when it comes to adoption, those that make more are using those technologies more than those with lower incomes. So how do we as an industry offer these amazing technologies which would help somebody in their healthcare journey equally? That there is not a demographic barrier for using these really great innovations that we're coming up with.
So on the theme of integration and collaboration, this is all going down at HIMSS 21, which is also going to be the first time in a long time that we've had a lot of healthcare stakeholders actually together in person for an event. I know a lot of people are excited. Some of you listening might still be on the fence, and so we encourage you, if you can possibly make it out and safely, to do that. But I guess I'm curious, since you guys are all going to be there, is there anything you're excited about in terms of the event or events in general?
Just for me quickly, again, I have the patient voice, but what an amazing opportunity for us all to collectively come together and represent these different segments. Again, all of which are a part of the healthcare ecosystem, critical parts of the healthcare ecosystem. And we have, trust partners that are subject matter experts in their respective areas, and they're collectively working with a broad number of organizations for their individual segments. So I think it's going to be a really great, thought-provoking discussion on how we move forward.
Absolutely, I would second that, and I'll say, in addition to that, pandemic has been a really difficult time, but it's been very heartening for me to see in my 25 years career that the entire ecosystem, all stakeholders, whether it's payers, providers, pharma, all talking about patient centricity. So as we all come out of pandemic and try to move the mission forward, how do we continue to live that patient centricity theme in our workings, in our processes, in our activities, and continue to help move the mission forward for healthcare? That's keeping me very excited, and I'm really looking forward to it.
Yeah, I would echo that. Interacting with lots of people in a non-digital means and modality is exciting. I think we've all come to be pretty functional in this kind of a setting where our face-to-face is still digital. But I don't think we've probably all started to forget what human interaction at scale looks like. And I do think the success of HIMSS in previous conferences and the scale, and that's the reason people go there, is for that experience and for being able to interact and communicate with diverse stakeholders in each of our individual represented areas here. But it's the serendipity of the introduction of the random person you meet and learn something that you wouldn't have otherwise thought about, right? Video visits are inherently agenda driven. We're here based on state of, future of. Just walk in the halls at HIMSS. You have the chance of running into someone who will kind of enlighten you and start a conversation on something you'd never even thought of. Can't do that on a virtual platform.
Awesome. Well, thank you all so much for being here with me, for chatting about this a little bit. I'm very much looking forward to seeing you all next month, and to seeing some of the presentations about the future of healthcare.
Today we have with us Dr. Daryl Gibbons-Isaac. Thank you so much for joining us.
Thanks for having me. Really pleased to be here.
I'm really excited to see your presentation at the Future of Healthcare event for HIMSS. So I wanted to sort of dive into what we can expect. At the State of Healthcare event, everyone presented survey data about current trends and perspectives in healthcare. Will the Future of Healthcare event be similar?
I think it'll be somewhat similar in that, once again, we'll be presenting some survey data, but this time with a few differences. It'll be focused on the future of healthcare, of course, and we'll be infusing some of our market perspectives and experiences in how we see healthcare evolving. And of course, we'll be in person, so more interaction and energy for those who can make it there.
What can people expect who are going to come?
So I don't want to give too much away, but I think some of the things that we'll touch on is that trust really matters. And it's one of the core tenets of healthcare delivery, of course, and that extends to all members of the ecosystem. That's been important in the past, it's important today, and I think it'll be even more important in the future. One more thing I'll say is that not everything we say will necessarily be true. There may be a few myths in there too.
Yeah, and more generally, as you look ahead into the future of healthcare, what trends are you excited about?
That's a great question. I think really technology is an enabler to humanize healthcare, really at a depth and scale that we've not really seen before. And what do I mean by that? I guess leading with empathy and using technology to really reshape access, experience, and the outcomes of healthcare. I think that's something I'm really excited about because we're finally at a point where I think this can really move in a dramatic way.
Where do you think some of the biggest uncertainties in healthcare are right now?
Oh, that's a great question. I think within the US, without a doubt, that probably has to be reimbursement. I don't think there's anybody that can predict what will happen there with a high degree of confidence. If they tell you they can, then you should be a little bit skeptical.
Now, is there anything you're really excited about for HIMSS 21 next month?
I think really meeting everyone in person. The virtual world is great, but it's even better when paired with the in-person world. And the second thing, this is actually gonna be my first time being there. So really looking forward to soaking up the atmosphere, sharing some insights and making some new connections.
Obviously, the COVID-19 pandemic shaped healthcare. How do you think that the innovations that happened during the pandemic, or maybe even mindsets, changes that happened, are going to shape the future of health?
I mean, I think there's been already a lot more awareness when it comes to the different kind of tools that are out there. So that awareness and familiarity, hopefully some successes that have happened there should build a good foundation for continued adoption going forward.
And is there any kind of innovation that you're excited about in the future?
I think it's really a combination of innovations, honestly. I think really the idea that we can have location agnostic care where you can receive care wherever you are, and it's not actually confined to the walls of a hospital, clinic, etc. We're at a point where there are many different technologies which have converged to enable that to happen.
And do you think the patient-provider experience has changed at all, and what that relationship looks like?
Absolutely. I think in some ways it has. And in some ways it really hasn't. So in ways it hasn't, it's probably trust being a core tenet of that interaction. But we're bringing other actors into the room, all around that interaction. So I think the way that you have to navigate with those extra pieces that are coming into the room are changing that interaction, and hopefully for the better.
Is there anything I haven't asked yet you think is important to add, either about this event or about the future of healthcare to you?
No, I think this has been great coverage. I don't really want to give away everything that we're going to be talking about. So I look forward to seeing everyone there and sharing what we found.
Well, thank you so much for joining me. This was great. And I'm really looking forward to having you at HIMSS and actually seeing your event in person. And for everybody out there, this is HIMSScast, and I'm Laura Lovett signing off.
All right, welcome back. And again, thank you all so much for listening. Thank you all so much for participating. I'd be remiss if I didn't also mention that there is a great digital program associated with HIMSS 21 if you're not able to make it on the ground. So please do check out our website and some of the links in the show notes for some information about all of those opportunities. We'll also link back to our coverage of the State of Healthcare event, both a written coverage and a previous podcast we did on it. So check all that out if you want to learn more about what we've been talking about today.